Greetings from Radhakrishna. We are doing videos on the Bridgital Nation book. It's written by the Tatas. Bridging the rural and urban, bridging the gaps and aspirations, bridging the today and the future. That's about the Bridgital Nation with a new process, new technology and skilled people. We are in the sixth chapter. Sixth chapter, we are talking about the twice exceptional. So what is so exception? We'll quickly look into it. Let's go to the Barak Valley in Assam and a Silchar Meherpur road. This is where you have a decent list of cancer hospitals, and this is the place the cancer is treated and more number of cancer patients go back with a good health. Now let's look at the Kalyani Hospital. Kalyani Hospital was run by Dr. Das. So Dr. Das was the one who actually asked our Nikhil Burman to do the coordination, the medical coordination. So when the Tata's team visited Meherpur Road and Kalyani Hospital, when they went into the hospital, doctors, our Dr. Das and supporting doctors and nurses went into the operation theatre in the morning 9 a.m. and they only came back after 12 hours and they did 10 operations. So that's the kind of place it is where you have good number of hospitals and good doctors, and altogether the Kalyani Hospital and Dr. Das are actually serving the patients at very low cost. Now what Mr. Dr. Das says is, giving a prescription is easy, but look at that patient. He is not even having a money to buy the medicine. He is not having a money to get the treatment done. So Dr. Das has to keep on raising the CSR funds. So he says, do I need to raise funds, or do I need to keep signing the documents, retaining the doctors, retaining the nurses, administrators? It's a one-man show. Sometimes he feels he's overloaded, he's overburdened, but any small drop, operations are not happening. The team is not coming together. So he has to continue doing it, and people call him as a Bhagavan and people call him as a God over there. So let's go a little more deep into the how Dr. Das and that particular place has been exceptional. What they say is Dr. Das is earning 2.5 crores in a year and serving 15,000 patients. 15,000 patients in a year. And if you look into the dollars, they are earning $350,000. That is not even $1,000 per day, which is a big challenge for the hospital. They want to earn more. They want to pay more to the doctors. They want to bring the better infrastructure. But the moment you start doing the better payments and better infrastructure, so they never wanted to increase the cost to the patient. Dr. Das, he left a successful private practice in the United States, turned away from the lucrative opportunities available in India, big city hospitals, and followed his heart to his hometown, Silchar. His patients traveled hundreds of kilometers for basic surgeries like gallbladder stones, kidney stones. There was a challenge. So do we need to do the cancer treatments? Do we need to take care of the smaller surgeries? They have to do both. The moment they reject, they cannot afford in the other hospitals. So Dr. Das is an exceptional, Kalyani Hospital is an exceptional, and the place Silchar is also exceptional because the more number of cancer hospitals are there. So the treatment is guaranteed irrespective of the price. Everything required money, so they kept on raising the money, and they were never able to charge even the menu card or the charge card they have given to the patients. So patients always come back and ask for the discounts, and our Dr. Das was very humble in giving those discounts. Now we need more such doctors. We need more such teams who can do more number of operations and bring down the cost to the patient. So what Dr. Das is, it's a jugaad. So how many years we can go with this kind of jugaad? He says, I imagine Kalyani will become likely any other nursing home or hospital, more mercenary than missionary. So what he is saying is, they cannot have a kind of missionary hospital where you will have a hi-fi infrastructure and then charging high to the patients and giving more to the doctors and living a happy life. No, they have to continue living the mercenary life, and mercy on the patients is more important, is what he is saying. And his aim is always has been to give cheap but a best care at affordable prices. That's about the Twice Exceptional. Thank you, Radhakrishna Tatwarthi, CEO and founder of BMV.Money and Oxy Loans. Thank you.